we all know that every good gift comes from above, from our Father. He often uses intermediaries, and we know that those resources come from a lot of different places. So this last session, I know, is of great interest. Where in the world do we get those resources? We pray. We also have to submit grants to various places and work to get the resources to do the great work that we're trying to do. So we have 3 panelists who are going to talk about money and resources. So I'd actually like to start with David Stanton, who is an old friend of mine from when I was at USAID. What I didn't know is that he started in Peace Corps in Liberia. We've been talking a lot about Liberia and have many from there today. He came to USAID in 1997. So I got there in 2001, and we had this little tiny AIDS office. It was 6 people and a tiny amount of money, and then PEPFAR came and the place exploded, and David was one of the ones that shepherded that just phenomenal growth of what the U.S. government was doing to address HIV/AIDS across the world. In September 2016, he left the Office of HIV/AIDS. He's now the senior science leader, and then moved up to acting deputy assistant administrator for global health. And I would dearly have loved to have had you as my DAA when I was there. I had great people, but David, it's fabulous. And I'm going to turn it over to him first to talk about the U.S. government funding, both what's happening now, which we know there's many changes, but then also how do faith-based organizations connect with the U.S. government? What are some of the pros and cons? And we're going to try and make sure that you have lots of time for question and answer.
Thank you very much. It's true that Ann and I are old friends, but we're still quite young, aren't we? Yeah. It's nice to be here. Thank you for inviting me. And I've just in the hour that I've been here already run into a number of old friends, and that's great. But the challenge is that when people know you already, you can't embellish your stories so well. The other thing I will say, one of my favorite jokes right now is if I had to describe myself in one word, it would be I don't follow directions. So I'm gonna divert a little bit. I'm going to divert a little bit from perhaps what you would like me to talk about, mainly because this would be a whole lot easier to do in about 6 months. We're in a period of transition. That's why I'm a deputy assistant administrator. I mean, the science leader position you described, I got to do for 2 weeks. And then the transition hit, and I got pulled in other directions. So in terms of how to access resources at USAID. Frank, thank you for the story and the plug for USAID. Afterward, I want to compare some notes about Zaire with you because I bet we know some of the same people. But we are, as an organization, we have a long history of working with faith-based organizations. Looking at some of the logos I see around the room, I know that some of you already, in many ways, have worked with USAID. So it isn't entirely a foreign thought to work for the U.S. government or to work under a program that's funded through the U.S. government. I think the real question is, one is how much money is there, and 2, how do we get some? And I don't know how to answer those 2 questions yet. I'll tell you sort of where we stand, and it's a work in progress. The administration has submitted a budget to Congress. It had to do that back in May. Many of you have read that. One of your former members told me they read that, and it was a blow to the gut when they saw the cuts that were coming to state and USAID. And we felt that way also, to be candid, that, wow, this is a big change coming. The Constitution says that Congress defines the federal budget, and so now they are in the process of doing their job. We're getting, some signals this week out of the House that perhaps those cuts are not going to be as deep. But we won't know until the ink is dry on an appropriations. I think it is useful to know that even with the very steep cuts in USAID in the proposed budget, that the health sector was actually quite protected. That doesn't mean we did not we weren't unscathed. We see some huge reductions, but the health budget was protected, and in fact, the other piece of tea leaves that perhaps you don't know about is we're also in a process of trying to understand how the State Department and USAID will work together and be organized in the coming years. So it is a moment of great uncertainty, embracing the ambiguity. We're doing the best we can. I think in terms of the tea leaves you might want to read, I would say number one, remember that this is an organization that has worked with faith-based organizations for decades, that we have an office that is a liaison to faith-based organizations, and that in all likelihood we have an administrator who's going to join us with any luck next week. He's Ambassador Mark Brown, who I've met and I have a lot of respect for, and you will too. He was voted out of committee in the Senate a couple days ago, waiting for a vote in the full House, and we don't expect any fireworks in that process, but it's a matter of timing and getting the vote to the Hill. But when we have an administrator, when I have a boss, when I have somebody who will tell me, this is the direction we're going, this is what we're going to do, this is how we're going to do it, there'll be a lot more to talk about. And I wish I could say more. We all wish we could, but that's where we stand. Now, here's where I'm going to not follow directions just a little bit. Because I think in terms of what the faith community has done, and Dan's story is a good example of being, the pioneer in some new areas. I think in terms of how the faith community, when it comes to health, postures itself, I think it's important to really appreciate the changing world we live in. And I think there are a few areas that are, for all of us as sort of partners in this changing world, things that we're going to have to address because what worked in international health in 1961 when USAID was created is a couple things that are going on. I think that one, there was a session this week on non-communicable diseases. And the statistics are overwhelming that more and more the leading causes of death and suffering in the world are now things like cardiovascular disease, cancer, diabetes, and the reason for this is more complicated than I think we want to know, but complicated can also mean interesting, and I would ask you to take an interest in that. People ask, where is USAID in this field? And the answer is, we are really interested. But know this, we do what we do because Congress gives us money and says, do that. And so we fund programs in AIDS, malaria, neglected tropical diseases, maternal child health, because Congress says, here's money for that program, get out there and run that program. So we, when the leaders of our legislative branch take an interest in non-communicable diseases, I imagine we will be very happy to step into that space right away. We're already having some discussions internally about how we might add some flexibility to our existing programs where we can start to bring in an approach to that. So I think that's one area that everyone is watching. We know that this is a responsibility in terms of how we approach health. The second area is some changes in the way health is financed around the world. Somewhere in the last few years, we hit a fulcrum, and that fulcrum was that the donor community, the donor contributions to international health flattened, while domestic resources, the governments themselves, their contributions increased. And that's a good sign. But it also means that the locus of control shifts when that happens. And one of the things that we're very proud of is that it's great to go to a country and help them with their health systems, train their doctors and nurses and what have you. But one way to improve the health of people around the world is to convince their governments to spend more money on the health of their own people. And that's starting to happen. And the fastest growing economies in the world are, surprisingly, in sub-Saharan Africa. Now they're going from small, really, really small to just really, really small, but that pace is very fast. And I think it's something that we're all going to wrestle with in terms of who is actually in the lead in terms of financing health around the world. And it's going to change who sits at the table and who has the big chair and who has the small But I think, I mean, from my own personal opinion, it is a very good trend to see government stepping up financially. The third one is not really health related, but it's going to make a big difference. And again, it's about the changing world, and it's about urbanization. Somewhere in the last few years, again, we hit a fulcrum. And I had some notes which I left in my car, so I can't tell you exactly what year, but I knew it a moment ago, that somewhere in the last 5 to 10 years, more than half of the world's population started living in cities. And that is going to snowball. And in theory, it is very efficient to provide services to people living in cities because you have the economy of scale. Everybody's in one place and they're really close together, and we can just bring in food and doctors and education and what have you. We all know in practice it doesn't work so well. And what's going to happen is the needs in terms of water and sanitation, health systems that respond to urban poor populations where the housing, you could huff and puff and blow it down. Those needs and how we provide healthcare in that setting, which is where the future is going to be very important. I say all these things because you are the communities that actually get out there and do the pioneering work that help us understand that. Just as you pioneered rural health systems, we need now to pioneer the urban systems. It's not blank slates, I know a lot of you work in that. I think the last thing I'll say, and then I'll stop, is the security environment that we're going to find ourselves working in. A lot of the places with the greatest health needs are that way because there's war all around them. And populations of people are moving, and they are at the whim and fortunately the mercy of people who are there to provide those services. But it gives us a great challenge. A companion to all that is famine, which is a crisis that I think everyone is acutely aware of right now. I was taught, when I took a degree in public health, that famine is a political construction. Yes, there's drought and crop failures and people get hungry, but mass starvation is something that humans do. And it means either somebody is preventing food resources from entering a community, or those who have those resources have chosen not to bring those resources. And so part and parcel of the security situation is this human construct of famine and what that does. And I think in terms of looking forward, what it means is we're going to all have to work in some more dangerous places. We're all probably going to be engaged in more humanitarian assistance on the side as we try to build long-lasting systems, but that this is the world that I think most people who study it see us walking into, and these are the challenges. I'm very happy, on behalf of the American government, to say it's a delight to know that we have at our within the family of development professions, the faith-based community, which by and large is, I hate to coin the phrase, but I will do it anyway, we'll go where angels fear to tread. So thank you very much for that. Sorry, I get a little emotional. Thank you for all of that. But just to say that this is the world we live in, and it's a shared future, and we look forward to going there together with you. Thank you.
Thank you very much, David. And while the news from the U.S. government and the funding envelope is less than ideal, and we will certainly wait and watch carefully as time goes on, I'm really happy to hear about NCDs and urbanization and crisis and conflict. I've been pushing my own organization really hard to go that direction, as I see it as a great need going forward. Let's go to food insecurity and famine. We have William Moore, who's the Executive Director for the Eleanor Crook Foundation, which is based out of Austin, Texas. He was formerly a chief storyteller, so I'm really looking forward to that, for the Millennium Challenge Corporation. So UN Millennium, yes, you're right, campaign, and working on the SDGs. And he's been on the board for Bread for the World and the Open Road Alliance. So a lot of different aspects, but I really look forward to hearing what the foundation, and many of you know that we've got a really big foundation, the Gates Foundation, but there are many, many, many other foundations, and to hear from William about the Crook Foundation, why their focus is on food insecurity, and again, how do we connect with the desires of the foundations. Thank you.
Thanks, Anne. Good afternoon. Thank you guys so much for sticking around with us to the tail end here. I just wanted to start by extending a quick thanks to Bob and Mona and the whole team at CCIH for bringing us together this week to learn from each other, to grow together in faith, and to thank them also for amplifying the collective Christian voice on global health issues. Be it down the road with our leaders in Washington or at other important international forums. The work you guys are doing is so important, so thank you. The Eleanor Crook Foundation is a growing faith-based family philanthropy focused on research and advocacy for global nutrition. And you guys can ask me later about why nutrition. I'm happy to talk your ear off. But I want to get to the brass tacks here and help you guys think about some additional ways that you guys can raise some more money, because that's what we're here to do. The bishop of my church a few years ago said we needed to start doing more to praise the money. And he's got our church and other churches putting the collection plate up on the altar for the duration of the service, praising the money, and that drives my grandmother absolutely up the walls crazy. If you guys come for dinner, she will still probably tell you about it. But I think he's right. We may not do this work for the money, but we certainly couldn't do it without it. So from a foundation perspective, from a family foundation perspective, I think David's right. The world is changing in a lot of ways, and that certainly extends to the family foundation world as well. I think for the most part, family foundations are becoming a bit more like larger, more institutional foundations. I think we're starting to hire more technical expert staff. I think we're starting to develop more of a specific, often sectoral focus. And I think we're starting to ask tougher questions of our grantees. And it's important that the faith-based community and that the NGO community as a whole is able to respond to that shift. I think it's a positive shift. So I just want to spend a few minutes here talking about why we as a foundation choose to fund faith-based organizations. So two quick reasons. And I also want to say neither of them is because we ourselves are a faith-based foundation. We also fund secular organizations. So both of these reasons have everything to do with results. The first reason is that we find that our faith-based grantees have an unrivaled ability to focus on nourishing the whole person, and an unrivaled ability to really go in and work hand in hand with the local community. It's not about dropping in somewhere for 3 years to do a sectoral program to raise this indicator and that indicator and write a report about it and jet off to the next place. When our faith-based organizations go into a place, they're committing themselves for the long haul. Statistically, they're going to be there longer. And statistically, they are going to do more to build up the existing local institutions rather than work against those institutions. And we find that they're going to really do all that they can to help community members access all the tools they need to live happy and healthy and dignified lives. So I think it's important to highlight that unique advantage that faith-based organizations are able to bring. Now, the second reason I think is a bit less recognized, but it's worth pointing out because it's true and it's fundamentally important. And that's that faith-based organizations, as David said, have led the charge and are leading the charge to bring more data-driven approaches, to bring more scientific breakthroughs to global health. I think that our secular culture, which influences many foundations, many secular foundations especially, can set up a false dichotomy between faith-inspired people and organizations on the one hand and science on the other, and a false belief that faith-inspired people and faith-inspired organizations don't believe in science. And I think everybody here would agree with me that that's just not true. Our foundation is funded by a long line of Christian businessmen who have always brought the latest market analysis, the latest technological advancements to bear in their business. And I think similarly, the faith-based organizations that we fund are absolutely zealous about bringing the rigors of science to their programming. So I encourage you guys, because I know that you guys are doing this as well, to really talk that up with funders. Lead with that. Lead with the cutting edge scientific approaches that you're bringing to your interventions. Lead with talking about your monitoring and evaluation plan. Introduce foundation representatives to your WASH lead, to your nutrition lead, to your research lead. And if you don't have a monitoring and evaluation plan, you need to get one. If you don't have global health experts on staff, you need to hire them. It's the best investment you can make, and I think it will definitely pay off when you're interacting with foundations and institutional donors.
I got the experts and the M&E, and I love data. I have been in government for a long time, and then I was a faith-supported missionary, and then I was in academia. I did not realize till I got to my present position what it takes to do fundraising within the private sector, to connect with donors and really get to the place where they can fund the things you want to do. So Joan Geiger Wood is an expert at this. She spent more than 25 years doing fundraising, more than $115 million for various nonprofit organizations, and is running her own company. So the care and nurture of donors was new to me. It's fascinating, and it's a skill set that I'm sure she can give us a lot of pointers on how to walk that plank. Thanks.
Well, thank you, Anne. Can everybody hear me okay? Okay. I did bring cheat sheets, so I have to manage the mic and that. What I thought I'd talk about, how we engage donors. I think the secular world can learn a lot from the faith-based world. So I thought first we'd look at what does the faith-based world do well? What do FBOs do well? So I've got a list of those. So first of all, they ask. They ask regularly. They ask often. They're not afraid to ask. They ask and put an ask out there. So I would mark that as number one in terms of how you're going to raise more money from individuals. And number two, they ask everybody. The organizations that are really effective are not just asking a few people. They're not just picking a couple. They're asking everyone, knowing that everyone has the potential to give, particularly the ones who are the most enthusiastic about what your organization is doing. And they ask for large amounts. As you know, in the Christian community, there's a 10% tithe. And, how many of you are asking for people to give 10% of their income? So, it's a large amount that organizations are asking for. It's also, there's a perception is that it's expected, that everybody in the congregation is giving. There's an assumption of giving, and in fact that they want to give and are proud to give. So there's a perception and an expectation that's in there as well. Faith-based organizations also give lots of options. So I have clients who do this and say, oh, I only want unrestricted gifts, or I only want this. But the groups that do it really well are ones who are giving donors lots of options. So in the faith-based organizations, they might be, passing the basket on Sunday, but they're also looking for a building fund gift or for camp so there are different ways, and they try to match up what the donor is interested in with what they have to what they're raising money for. Next point is that they use volunteers, and I know everybody talks now about peer-to-peer fundraising as if it's this new beast, but it's not. It's been around for hundreds of years. But it is the most effective way to raise money, is to have someone fundraising to their contacts on your behalf. So they use volunteers well. And then the last point is that they build really great relationships. And for the most part, they're seeing their congregants every week. They're engaging with them. They know them. And so when it comes time to ask for a gift, they've already laid that groundwork. They know what they're interested in, and they've already learned about that. So now I want to talk a little bit about what does that mean for us? What can we do from what we learn there? So the first thing is you have to be real clear on what you need money for, what your need is. Not just that you're doing great work or your organization is great, but you have to be ready to answer the gift. What if the question, if I gave you $1 million, what would you do with it? Or if I gave you $1,000, what would you do with it? And so that you're really clear what you're raising money for. You have a really strong, we call it a case for support. But it's not just why the organization is great or why the work is great, but why you need the money. So really making that connection between the mission of your organization and the need for money. And then secondly, the obvious one is you should ask. You should ask often, and you should ask regularly. You should honor people's wishes if they only want to be asked once a year, but still you should ask them once a year, and ask everybody else often. Ask everybody, another thing, a lot of folks will say, oh, we're waiting because we want to ask them for a big gift, so they put them in this special pot. I used to tell people, give $1,000 because you'll never hear from a group again, because they're like scared to approach you then. But they ask everybody. So it's not a matter of, only focusing on the biggest gifts or, not feeling that a $25 gift is just as important as that $1 million gift. But do ask for those $1 million gifts. Ask for those large gifts. So that's knowing, being able to talk about the impact that you're having, how their gift will make a difference, what you need that gift for. You had that answer for what you would do with that $1 million or 10 million or whatever, and you're able to articulate. A lot of that is good research too. Make sure you're not asking that $25 person for $1 million, but asking someone who can give that. Build that expectation that they donate, that the sort of culture of philanthropy, culture of fundraising, that everybody's giving, everybody's gift is valued, everybody's gift is expected, so do what you can to build that as well. And then also create lots of options for giving, just like the camp, and have lots of different things that they can fund in addition to or instead of a general operating gift. And have your volunteers ask for gifts. That's the best thing you can do. And in many faith-based organizations, that's a great model for build your entire fundraising program. But the trick in today's world is to make it be as easy as possible, right? People are so crazy busy, and so they click a button on their website, they're able to shoot out an email that you've drafted for them, really make it easy for a volunteer to do that. And lastly is build those relationships. So really get to know your donors, know what they're interested in, keep track of it, use databases, and really follow. When you say, I'll send you that material, send them that material, really stay on top of it and follow up. And that's what people expect and feel like you feel valued that way. They feel like their opinion is valued. So those are the things that I think, like how best to engage donors. Like it's really broad, but there's lots of fancy tools out there, but they're still all the same way to get you to know your donor and talk to them regularly. And so I think that's that can work on many different levels. So Those.
All right, the care and nurture of donors. Thank you. So I'm going to ask one question before I turn it over to the audience, because I know you have questions. USAID has long been known for accountability in making sure the monies given by USAID achieves something in results. But both Will and Joan also talked about results orientation, being able to say, for the money given, what will be the result? Could you talk a little bit more about that increasing trend of accounts and results from each one of you?
I'll do it from an individual basis because I think that's easy. It's different than what foundations or government reports might expect, but that there is an assumption. You'll talk about the impact, and then if someone's giving you a gift, you'll tell them how you spent it and how it made a difference. So it's, I think, a little simpler.
Yeah, and certainly from a government point of view, you remember, I mean, really what we're doing is we're spending your money. We're spending the taxpayers' money, and the expectation is that we make wise decisions and use it well. And certainly, I think in the last 15 years, I think really pushed by PEPFAR in many ways, is this sense of for this investment, what do I get back? And some of what we do, it's easier to do that than others. I think the health field enjoys a bit of a benefit in that a lot of what we do are things that can be counted. So how many kids did you vaccinate? How many babies got delivered? That sort of thing. I pity our friends at USAID who deal in democracy because that's a little harder to count. And sometimes you make a lot of progress and then you start all over again. But I think in terms of accountability, it's gone another step. And accountability used to be, we can show you the bank accounts and the money came here and we bought this and nobody did anything funny with the money. And that accountability is really important. But now it's more than that. This is what we spent it on. We could have spent it on 3 or 4 or 5 different things. We chose this because we knew your money would go farther if we did. And that makes it a little harder. And as Einstein apocryphally said, some things that count can't be counted, and some things that can be counted don't count. And so I know that a lot of the investments are in things that you know in your heart are intangible, but it's hard to say that having invested, especially for my colleagues in the health system field, that we invested in the health system and what do we have to show for it? And the answer, come back in 10 years, is the right answer, but it's hard when your donor has a 2-year lifespan. They're like, well, yes, the political lives are 2 years, but their attention span is 2 years. And these, I gave you money 2 years ago. What do you have to show for me? And the answer is the right answer, but also the wrong answer. So be ready for having those intermediate results. Just like the space program, it took a decade to get a man on the moon, but in the meantime, we got things like Mylar and microchips and calculators and a lot of other things. What are the things that you're producing that are the equivalent in the kinds of work that you're doing? Say, we're not there yet, but look already what you've gotten for your investment.
Yeah, I think all that I'd add to that is really echo what Joan and David both said. And it reflects the changes in the donor culture, I think, that we do not see the money that we give as a gift. We do see it as an investment. And my board expects me to come to them each year and say, here is the level of impact that we've had with our money. And I, in turn, expect our grantees to be able to give us really accurate data about how our investments specifically affected the lives of the people that we're trying to serve. Now, I think the other thing that I'd say is, in terms of getting something actually in return for your investment, Joan's right in that folks, I think, want to be investing in something that's urgent and something that's new. So I encourage you guys, a lot of the grantees that we've worked with over a long time, that we give less restricted grants to, they get into this cycle of talking about the same thing year after year. We're continuing to do this, continuing to do that. And that's great, but I think when you're reaching out to donors, if you can say, we really, really need funding for this, and here's this really exciting idea that we're this close to making happen, and we just need a little bit of support from you to get there. I think giving them that tangible for their investment is a really effective way to get folks to give more.
The audience.
Sorry, some of our microphones have gone out, so we're going to play microphone.
There's a question in the back as well.
Okay. Yeah, I'm Perry Jansen. I'm currently working with MedSend, but I'm a missionary with SIM and just finished service of 16 years in Malawi, including running a large USAID project. So my perspective might be skewed, but in my perception, it seems that U.S. government funding is moving towards favoring funding very large consortia who are doing multi-country interventions for large and large amounts of money. And what we see on the field is that often that it creates a disadvantage for the local partners, especially FBOs, who really don't have the political connections or the people to put together the really slick multi-country projects. And I don't maybe comment about whether that's true or whether is that really the trend intentionally, or and what's the justification for that?
Well, thanks a lot. I don't have a quick answer for you, so give me a little time. Trend is probably the wrong word. Pendulum is probably a better word. And it comes and goes. I've worked at USAID nearly 20 years, and I can tell you, and we're having this conversation internally, which is, why do you do these things the way you do? And oftentimes the answer is, we don't think that these are the best way to get things done either, but these are the ways we can get things done. And a couple things to bear in mind in terms of working with large partners is that when your capacity to manage multiple programs is diminished, it's easier to manage one big one than lots of little ones. And in fact, the little ones are often the biggest management burden. And so we are in a hiring freeze for probably the next year and a half. I can't bring on any additional grants managers. So the question is, with the management capacity you have and the need to get things done, you tend towards these things that are big and long-lasting because the machinery that you're working with kind of tilts in that direction. I think in terms of the smaller organizations on the ground, one of the recurring conversations we have is, are you interested in having a direct funding relationship with the U.S. government, or are you willing to be a subaward under someone else? And be careful what you wish for. The direct funding relationship with the U.S. government comes with a tremendous amount of accountability responsibilities, and the need for financial systems and management systems in place, passing audits and what have you, in order for the U.S. government to say, yes, this is an organization we can give taxpayer dollars to. It is much easier if we have an umbrella organization that works with the smaller organizations that need to develop organizationally to be able to do that. And in the time that I've been at USAID, I've seen a number of organizations that have gone from the small subawards to then building up the systems directly. But I often hear anecdotes of, I went to USAID and I asked for a grant of $5,000 and they said, you don't qualify. And whether that's fair or not, that actually is the case, that small organization probably doesn't have that and doesn't really want the burden of pulling together the kinds of accountability requirements that go into that. We have met with some of the new political arrivals at USAID and expressed, we You have from the outside looking, you have an aversion to that kind of doing business. You're not really keen on it either. Can you help us? Can you put more, we have to fill an embassy, and the embassies are filled to the brim right now. And the ambassador said, I'm not going to bring one more American manager into USAID because I don't have a place for them. So with that constraint management staff, then you end up, those kinds of decisions end up driving what you see. We're hoping that will change, but it's going to take people cashing in some political capital to make that change. That's not your political capital. I'm talking about people with pay grades far higher than mine.
I will just say when I was at USAID, exactly that. It's hard to manage a lot of little, but this is a place where CCIH can make a difference, right? We have a number of large faith-based organizations as well as members who are large USAID recipients, and we have all of our church hospital associations. So we have the way to bring smaller groups together. Look at in the business meeting, Mona talked about the grants that we have where CCIH is working with the church hospital associations in a couple different countries and pulling them together. So CCIH is your organization. Look at how we can take our network and help David overcome his problem of needing to have larger singular ones with an umbrella organization and meet your financial needs. Other questions?
Hello. Wow, okay, this is the right distance here. Paul Mosley from Mennonite Central Committee, and I've also worked in the past as a proposal manager and for a number of USAID grants. And one thing that I've noticed a trend for projects that have won awards is more of a movement now towards grants that involve either public-private partnership or some kind of cost sharing where an organization can demonstrate that there is going to be some kind of shared cost from somehow the beneficiary community in some way. And I feel like if you would, and I'm wondering about private foundations as well, whether that's something that's seen as positive as opposed to just, let's say, trainings where you just go out and have people teach something. And if you would give some advice about projects that are intriguing, maybe not even at the highest level, but projects that would be intriguing to donors in terms of that kind of idea.
Thanks. And just whoever has the microphone, I see a hand up here, right? Yeah. The audience is a faith-based organization, so I wasn't going to go into the private sector, but it is an area of great interest. I'm actually sitting on a number of committees internally that's trying to figure out how we engage the private sector. It's very, at the 25th anniversary of the World Bank, my favorite statistic was in 1 year, the private sector invested more in Africa in 1 year than the World Bank invested in its entire first 25 years. So there are trillions of dollars going in there, and everyone says if we could leverage some just little slice of that, we could do. But it's easier said than done. And I think the more important thing than easier said than done is to make sure is engaging the private sector a means to an end or an end in itself? Is your goal a ribbon cutting ceremony? Then I'm not interested in that. I'm interested again in all the things we've been talking about as results. How does working with the private sector advance your goals, our goals, and the results that we're trying to achieve? And if it does, let's just move on that. If it's just a matter of we want to show that we've worked with the private sector for the sake of showing we worked with the private sector, it probably, well, actually, it will resonate in certain circles, we know that. But in the end of the day, you aren't going to have a lot to show for it. So I would say look at that, but remember, it's a means to an end, not an end.
All right. Hi, Paul Mikov. Thanks, everyone, for your intervention so far. David, the USAID and its logo has probably one of the most evocative and heartwarming taglines, "From the American people." And yet it seems to me that many of the American people make decisions and view international assistance, foreign assistance, on the basis of a very limited story and narrative. And they operate with minimal information and knowledge. Could more be done about the fact that the total foreign assistance of the United States is less than 1%? Could USAID and all of the other related agencies and players like yourself and others, in addition to all of us who are running around and trying to do that to some extent, whenever we can, but presumably those that have more access to decision makers, policy makers who mingle among their constituencies and voters, could more be done about educating and informing the great, marvelous American people, and the fact that less than 1% is absolutely peanuts by comparison. Same story applies to the UN. I was for 7 years the UN representative for World Vision International, still in New York and operate in those circles. And now this is a very pronounced kind of issue. The fact that the US government's contribution to the United Nations total budget of US's contribution, $3.2 or $3 billion, is absolutely peanuts. But most American people cannot stand the United Nations because they think half of the United States money goes into the UN and it's wasted. I mean, this is an exaggeration in order to make a point, but it is a big issue. Some of us optimists, hopefully not overly naive optimists, think and believe that with a bit more education and information and shaping the minds and the hearts of the wonderful American people, many more American people would actually be more supportive of the United States government and this lovely country doing actually much more. I mean, among the OECD countries, we all know that, the US is really at the bottom in terms of per capita giving. What could be done about it?
Just to morph the question a little bit, because I know David can't advocate for an increased U.S. government budget, but to the both of you, but then also to David, how can we, the faith-based organizations, help you all tell the story of the need for U.S. government funding, for private funding, for foundation funding, for the things we care about? How do you mobilize us to help you?
I have a couple comments there. The one is, I think a lot of the organizations put the funders in a box so that your revenue is coming from USAID or from government funds and you don't do anything else, or maybe you just get government and foundation funding and nothing else. But the work you're doing to get those gifts is the same work that would motivate individuals to give. And in the United States last year, 72% of charitable revenue came from individuals. And that number has stayed pretty steady for the last decade or so. So, 3/4 of charitable donations are coming from individuals. And a third of those gifts go to religious organizations. So it's a sizable chunk of people who are giving charitably. So to me, it's a question of how do you frame your message to appeal to not just get government grants and not just get foundations, but also to get individuals to give, and using a lot of that data and a lot of the impact and to have conversations. I think that in terms of the public-private partnership, people are really interested in seeing that and understanding it. So having those conversations and diversifying where you get your funding from and why it's so important. I think that there is great misperceptions about where government funding is actually going.
I'm glad David's here to get all the tough questions. Could we be doing more? Should we be doing more? Absolutely. The Eleanor Crook Foundation is focused intensively on advocating in Washington and in other circles to increase funding levels for international development and global health, and to make that funding more effective. David might not be able to say that we should raise funding levels, but as he pointed out earlier, this is a cyclical relationship. We can, because he's spending our money. And I have to say that the voices in this room, faith voices in our country, carry far and they carry loudly in Washington. And that's true always on both sides of the aisle, but that is especially true right now. And we're doing the best that we can as a foundation to try and give faith leaders and faith communities more seats at the table. But we need you guys to take part. So I encourage everybody here, organize a letter writing campaign with your church. Figure out how your organization can be involved in advocacy to improve some of these issues. You can reach out to Mona and CCIH. We work with them to try and give Christian organizations more of a voice in Washington. You can reach out to the foundation directly, but we really need your voice, because I think more than any other group in our country right now, the Christian voice can really move the needle on this issue.
Well, first, Anne, thank you for that civics lesson. And it's one I engage in all the time, that as a employee of the government, I am by law barred from asking Congress to raise my program levels. So I can't do that. But yeah, you can. And yes, your voices are actually very potent. And so I would, you have clout, and I wouldn't ignore that. And is it 25% or less than 1%? I've been having that conversation for almost 20 years now. But I think it's, so part of the problem is advocacy for foreign aid. There isn't a strong groundswell. You don't have people on the Hill that are organized and really working for international health the way you might see for an industry group in the United States. And I can understand that to an extent, because you want to talk to your representative about your life and not someone else's. That said, I think there's a lot to be said for not just lobbying the Hill, but also just talking to people, because we live in this environment where we think you're in one of a few different boxes, and that's the way you think, and that's what motivates you, and we all know that's not true. And if you engage someone one-on-one, you'll find out the complexity of their lives and yours, and their thinking and yours. And I think one of the things that I've seen since I was a Peace Corps volunteer was really how generous and how compassionate the American people really are. And when you say, this is the situation, would you help? They will. And so it's the U.S. government. We're the 800-pound gorilla with a big budget. But don't forget that the non-governmental funding that goes around the world is enormous. And I don't know the statistic, but if you put it all together, it probably dwarfs what the government does. And so be optimistic, engage people, engage your elected leaders, and you'd be surprised what you can get.
I know I have more questions than you probably do too, but Mona said we're done. So join me in thanking the panel for a forthright discussion on how do we keep it going. Thank you. Thank you.